myself.
Good. Okay, my name is Hailey, and I'm going to talk about hip dysplasia in German Shepherd dogs. Data provided by the German Shepherd Breeding Association shows that of all the German Shepherds x-rayed from 1998 to 2000, 13% of them had hip dysplasia at the time of their x-rays. This information is from the Journal of Animal and Breeding Genetics, 2003 article, Bayesian Analysis of Heritability of Canine Hip Dysplasia in German Shepherd Dogs. I work for a veterinarian, and I see dogs with anywhere from mild to severe hip dysplasia all the time, and especially in German Shepherds because they're so big and tend to work themselves so hard. And I'm sure every one of you has had a pet at some point, and I know you would hate for them to get hip dysplasia, so I would like for you to have some general information about it so that if you had an animal with it, you would know what to do. I'm going to give you some basic information and background on hip dysplasia, tell you what can cause it, how to go about preventing it in the first place, and how to treat it if a dog has it. First, I'm going to give you some general information and tell you what exactly canine hip dysplasia is. It is potentially life-threatening, and normally a dog's hip fits in its femur. It's a little socket and a ball joint, and they fit together. But when your dog has hip dysplasia, the joints and the ligaments that surround the hip and make sure the ball stays in the socket are lax, so it kind of falls out, or it wasn't formed properly in the first place. And I have a little bit of a scenario to show you, and it's not a German Shepherd, but I thought it was pretty cool because I just took this video and pictures and whatnot in the last week at the vet clinic where I work. This dog's name is Maxie. He's an Australian Shepherd Corgi mix. He's 7 years old, and he's neutered. And as you can see in this picture, he's kind of broad-chested up here from the back, but he's kind of wasted in his hips back here because he can't carry a whole lot of weight because his hips are bad. His owner said when he brought him in that he skips when he walks on his back end, and he appears to be in a lot of pain. This has been going on for several years and has slowly gotten worse. And here's a video of him walking so you can see what it looks like. You can see he doesn't put his feet down very good, and he's happy and all, but he can't walk very well. So at first we thought it was his knees that were causing him problems, but we wanted to do an x-ray. So we got permission to do the x-ray from the owners, and this was what it looked like. Sorry. These are his hips right here where the ball and socket joint should be. And here's a perfect example of how it should look. You can see where there's a perfect socket and it fits right into it. And here, Maxie has almost no socket for his hip joint to go in at all. And that is the cause of his pain, we figured out. So while there's not a whole lot we can do for Maxie right now, there could have been maybe a long time ago, maybe supplements to his diet and things like that. These are called OFA grade A hips, which means that they are perfect. The Orthopedic Foundation for Animals, or OFA, grades hips on just like you get grades in school, from A through, but it goes to E, not F. A is perfect, B is borderline, but still considered okay, not really, probably not going to get dysplasia. C is mild dysplasia, D is moderate, and E is severe dysplasia. And we didn't rate Maxie's hips because we don't do that at the vet clinic where I work. He wouldn't have been severe, he probably would have been a C or a D. Not severe, but he definitely has it. And according to Pet Education's 2014 article, Hip Dysplasia in Dogs, Diagnosis, Treatment, and Prevention, this separation in the femur and the hip is called a subluxation. And it causes changes in the size and shape of the bone surface, and they'll have little ridges or bone spurs all around there. And most dogs that develop hip dysplasia aren't born with it. They'll be born with their hips looking like this and slowly but surely get to where Maxie is right now. And here's an example of some very bad hips. These hips were grade E, which is the worst you can be. You can see they're not even in the socket like they're supposed to be. And then here's just a little diagram of it. You can see where those ridges all along that bone right there, and it doesn't fit in there very well. Just bad structure all the way around. And now let's talk about the factors that cause canine hip dysplasia in the first place. The main factor is genetics. So if the parents had hip dysplasia, puppies are most likely going to have it. According to Cornell University's College of Veterinary Medicine article in 2014 called Genetics of Canine Hip Dysplasia, breeding 2 dogs with hip dysplasia gives their offspring a 75% chance of having it. And the reason why it's a 75% chance is because what causes it is a mutation in the first place. So even dogs that don't have dysplasia can have puppies that have hip dysplasia because it's a polygenetic trait, which means there's multiple genes that go into it, and researchers aren't really sure of all, they haven't identified all of the genes that go along with it and cause it. So you can carry traits but it won't show up on an x-ray or anything, so you don't know that the puppies are going to have it. There are also environmental influences. If your dog had poor nutrition, maybe was on the streets for a long time before you got it, it could develop hip dysplasia from having bad bones, hips and joints and all that. If you have a very overweight dog, then they would be more likely to get hip dysplasia, or one that constantly is exercising and using and abusing their joints and everything, that they'll get lax and they'll wear down. And then there are most likely other factors, but they're unknown at this time. Researchers are heavily working on this. In Finland, out of a sample of over 10,000 German Shepherds who had hip radiographs done, 44% were diagnosed with canine hip dysplasia. According to the Journal of Animal Breeding and Genetics 2000 article, Heritability of Hip Dysplasia in German Shepherd Dogs in Finland. And according to the genetic analysis of elbow and hip dysplasia in the German Shepherd dog, in a 2011 article from the same journal, canine hip dysplasia is believed to be linked to canine elbow dysplasia, which is basically the same thing in the elbow. So if your dog has elbow dysplasia, it's more likely to get hip dysplasia and vice versa, which is pretty sad because you already messed up on one end, now you're messed up on the other end too. And finally, I would like to talk to you about preventing and treating canine hip dysplasia. There are a couple different ways you can prevent it. Obviously, don't breed dogs with hip dysplasia, and they'll have a much lesser chance of having it. Have x-rays done before you breed your dogs to confirm that they have good hips. And there's continuing research on identifying the genes to find out how we can do genetic testing to find out if dogs carry the traits for hip dysplasia. And then treating hip dysplasia. The first option would be to reduce the dog's exercise. Just kennel them up, let them get some rest on their joints and everything. If the dog is overweight, you'll need to feed them less. So obviously get them back in weight, and they'll feel a lot better. Even if that doesn't fix the dysplasia, it's going to help with the pain and everything. And I have a picture here of an overweight German Shepherd. You're not going to want to let that happen. So they'll age a lot faster when they're overweight as well. You can give your dogs non-steroid anti-inflammatories. They have specific ones for dogs. They're called Daramax and Rimadyl are the most common ones that'll just kind of help with the pain. Next option would be surgery. Dogs can have a total hip replacement, just like in people, or a triple pelvic osteotomy, which is normally done on younger dogs with hip dysplasia, which involves breaking the pelvic bones and then properly aligning them, which can be very painful and has a long recovery time, so it's not recommended much. And the final option would be a wheelchair. And this is a very young German Shepherd who had hip dysplasia from birth pretty much and had to be put in a wheelchair. She wasn't going to be able to walk anymore. And wheelchairs can be expensive and they're time intensive too, because you don't want your dog to be in and out of a wheelchair all day because they can't stay in it. You have to put them in and take them out and everything. In conclusion, canine hip dysplasia is very serious and has claimed many dogs' lives. Dog owners should be very educated about it and hopefully not buy from breeders who did not get their dog's hips x-rayed. Though if your dog does end up with hip dysplasia, there are many treatment options available to you and you will be well educated about this disease. As of right now, breeding two dogs that have absolutely no signs of hip dysplasia can still have a 25% chance of having it, and this is why researchers are trying so hard to identify all of the genes involved in hip dysplasia. Thank you.